Hello, I'm Dawn James, and I'm a second-year student for family nurse practitioner at Maryville University in St. Louis, and we're going to demonstrate today the head-to-toe physical examination. This is my volunteer patient, Taylor, and she has consented to be my volunteer patient. Before she came into the examination room, we did obtain vitals and weight, and her health history, family history, and surgical history, and her problem list. She's emptied her bladder and she's changed into some clothes to make it easier for me to review all the body systems with her. So first we're going to examine her skin, texture and color, and uniform smoothness all over. I don't see any areas of hypopigmentation or hyperpigmentation. I don't see any lesions or sores. I'm going to look at her hair texture and see that it does not come out easy. It looks very full. I don't see any lesions. And I'm going to look at the scalp for any flakiness or any excessive oiliness or scaling or patchiness. Her hair is very full. Moving on to her head examination. She doesn't have any bumps or tenderness or depressions. Her head is normal cephalic and she carries it midline. I'm going to examine for her facial bones and her sinus areas. Does this tender in any way?
No.
This is her frontal sinuses. This is her maxillary sinuses and her ethmoid sinuses, and she doesn't complain of any tenderness. I'm going to look at her eyes for symmetry, and I'm going to get my pen light. And we're going to check her pupils, both directly and indirect. Pupils are equal and round and reactive to light and accommodation. I'm going to look at hair distribution. It's even and it extends out past the orbit of the eye, and that's normal. I'm going to examine the conjunctiva. It is light pink and the sclera is pearly white. The conjunctiva in this side is also light pink and the sclera is pearly white. I don't notice any crusting, any exudate, any lesions, excessive wateriness or dryness or redness. I'm going to do the uncover and cover test with you. I need you to cover one eye and kind of stare at my nose and uncover, and I'm going to watch for any movement of your eye or any deviation to the middle. Can you do that one more time, just a little slower? Okay. All right, and it doesn't, this would be testing for strabismus. Okay, on your eye, you need to test for a red reflex, and that would be done with an ophthalmoscope. And my left eye should do her left eye. I'm going to turn this on, make sure it is +10, and stare right kind of at my nose or something. Okay, and I do see a red reflex. Okay, and I can see some, I can visualize some of the veins in there as well. She did the Rosenbaum near vision test before she came into the room and the Snellen distance test. We need to do the six cardinal fields of gaze. So what I need you to do is stare at this pen light, and I'm going to move it slowly in 6 directions and see that your eye follows it, not your head, okay? And while you're doing this, you want to watch for nystagmus or extraocular movements of the eyes. And this is testing the ocular motor cranial nerve. Okay. While we're here, we're also going to have you, I'm going to test your cranial nerves. I need you to raise your forehead. Good. Can you squeeze your eyes tight? Can you open them? Can you puff your cheeks? Can you clench your teeth? Can you smile? Just smile normal. Okay, and can you shrug your shoulders? Okay, all the while that you're doing these tests, you're making sure that everything is bilaterally symmetrical, and it was. These are testing the facial nerves, number 7, trigeminal nerve, number 5 for the clenching, and I need you to stick your tongue out and wag it back and forth, the hypoglossal nerve for movement of the tongue and speech. Okay, we're going to inspect your ears next. I want to inspect for placement and any lesions behind the auricle and any bumps or any crusting. I don't see any. Let me attach the head to my Okay, on the scope here. Okay. All right. I'm going to sit up here with you. You want to hold it laterally and pull up on their auricle pinna and balance your pinky on their cheeks so you don't stick it in too far and hurt them. Okay, I'm visualizing the normal amount of cerumen, which is wax. I don't see any erythema or lesions or foreign bodies. I can visualize the tympanic membrane, and it is pearly white and no bulging and no bubbling. Do the same thing on the other side. And you want to pull the auricle up and down on an adult. Again, normal amount of cerumen, maybe just a little bit more in this ear. No redness or erythema, no foreign bodies, no crusting. I can see the tympanic membrane, and it is pearly white and no bulging and no bubbles. Okay, we're going to move to your inspection of your nose. It appears to be straight. I don't see any deviations. Can you hold one side and breathe deeply? And try it again on the other side. This would test for deviated septum. Okay, I'm going to tip your nose up, and I'm going to inspect inside with this otoscope. And I do see a little area that's been bleeding, and there's a small clot. There is a lot of erythema. Taylor suffers from seasonal allergies. Turbinates appear to be a little bit edematous in this side, but I can visualize them. I don't see any crusting. I do see a lot of moisture and some drainage. Okay. And then this side, it's not nearly as erythematous, and I can visualize the turbinates, and she doesn't appear to have a deviated septum at all. Next, we're going to move on to her mouth, and you want to inspect, always inspect each body system before you move on. The lips are smooth and round, don't appear to have any cyanosis or cracks. Could you open wide for me? Let me grab my tongue depressor here. Okay. You want to test it for a gag reflex and the ah reflex. Can you say ah? Good. When she does that, I can see her uvula is midline, and she does not have any tonsils. I want to inspect and look for the oropharynx, the soft palate, hard palate, and the anterior and posterior pillars. While I'm in there, I want to inspect the oral buccal mucosa and under the tongue for any lesions that would be indicative of oral cancer. I want to count the teeth and look at the dentition and notice any odor, and I don't notice any. She has 28 teeth, and she does not have her wisdom teeth. Those were removed. We want to also do a bone conduction and air conduction test. What I'm going to do is smack this on my hand a little bit and hold it on the top of your head. You're going to feel and hear a sound, and tell me when you don't hear it anymore. Yeah. And tell me when you don't hear it anymore. Air conduction should be twice as long as bone conduction. Good. I'm going to do it again and hold this on your mastoid process. Tell me when you don't hear it. Okay. Okay. Try that one more time on your left side. Hold it on the mastoid process. All right. Okay, great. That tests out great. That tests out trochlear, or cranial nerve. I'm going to do your neck next. And first, we're going to start with palpating your thyroid. So I'm going to come behind here with warm hands. And I'm first going to feel the entire neck for any edema, or any nodules, or any bumps. And over your thyroid, I need you to swallow. Okay. And I felt the thyroid raise up, and that is normal. You want to feel it raise up. I didn't feel any nodules or any unevenness. I want to feel your trachea for midline position. It doesn't appear to be deviated. Next, I want to move on to her chest, And for cardium, I want to feel for any thrills or pulsations or any accessory muscle use during respirations, and that doesn't appear that Taylor has any of that. We want to test for range of motion, so I want you to press against my hand, keep me from pushing your head down. Okay, and on this side, good. Can you put your chin on your chest? Excellent. Can you tilt your head back? Good. Okay, we're also going to, while we're here, we're going to test the upper extremities and look for symmetry of muscles. I'm going to look at your hands. I'm going to look for any clubbing. I'm going to test the capillary refill, and it is less than 2 seconds. So I'm going to look for any unusual texture or dryness. You don't have any calluses. While we're here, let's do the reflexes in your upper extremities. Okay. Okay. And then your radial pulse or radial reflexes. And going back to the neck, we don't want to forget to do the carotids. So you want to look for jugular vein distension. Sometimes you need a little bit of light. Don't see any of that. I'm going to palpate. Yes. I'm going to palpate your radial pulse with your carotid at the same time, opposite sides, and it should be symmetrical, and it is. And again, on the other side. Oh, while we're in the neck region, we don't want to forget your lymph nodes, so let's go over those. First, we want to do pre-auricle, post-auricle, occipital nodes, and tell me if any of this is tender. Okay, submental, submandibular, tonsillary, supracervical, deep cervical chain, posterior cervical chain, and supraclavicular. And this one especially, if it was able to be palpated, would be an ominous sign of possible cancer. I don't feel any of those nodes. I'm going to also test your axillary nodes to see if I can palpate them. Okay. I want you to hold your arms out. We're going to test for some upper body extremity strength. Keep me from pushing your arms down, okay? And squeeze my hands. And the strength is bilateral. I'm going to have you adduct and abduct, supinate and pronate. Perfect. I'm going to listen to your lungs. Oh, before we move on, I need to do light touch sensation. Can you close your eyes and tell me which part of your face you feel this?
My left cheek. My right forehead region. My chin.
Okay. I'm going to listen to your lung sounds in the back. Every time you feel me touch the stethoscope to your back, I want you to take a deep breath in and let it out. Okay, sounds good. I did not hear any adventitious lung sounds in the posterior region of your lungs. While I'm back here, I'm going to do expansion. I'm going to hold my thumbs at the lower costal region of your posterior ribs, and I want you to take a nice deep breath. And my thumbs should expand about 3 to 5 centimeters, and they do, and that is perfect. I'm going to listen to your lung sounds in the front. Oh, also, while we're in the back, you want to test for the costovertebral tenderness. Does any of that hurt?
No.
Okay. Listen to lung sounds anteriorly. Also, before you do that, you watch them breathe, see if there's any accessory muscle use or any distress when breathing. And I don't see that. I'm going to listen to the lung fields in the front. Deep breath. And laterally. Okay, good. I didn't hear any adventitious lung sounds such as wheezing or stridor or rails or crackles. And her lung fields sound normal and bilaterally they're symmetrical. Next, we're going to listen to heart sounds. First, we're going to feel the precordium for any heaves or thrills or pulsations. I do not feel any. I'm going to listen to the loudest point of maximal impulse, which will be her apical pulse. And then we'll listen for S1 and S2, the heart sounds that are normal. This should be done with the bell. Apical pulse. You just breathe normal. Okay, so you listen for the aorta. And the pulmonic. Erb's point. Tricuspid. And mitral. And all of that sounds normal. She had a normal rate and rhythm, and I didn't hear any murmurs or heaves or thrills. So next we need to move on to your abdominal exam. If you could lie on your back, please. So I'm going to come around here. And let me grab a couple of little instruments here. Okay. First you want to inspect on any body system. You want to have some kind of source of tangible lighting and look at the contours and look for any pulsations, or on super duper skinny people you can actually see the peristalsis going on. She has a normal contour with the fullest part being right above the umbilicus. So you would always inspect first before you do anything else. Then you want to auscultate in all 4 quadrants of the abdomen. And we'll do that with the diaphragm. So first on her right lower quadrant of her abdomen, you should listen and hear at least 5 to 30 clicks. And I hear some. Your right upper quadrant of your abdomen. And there I hear some. Your left upper quadrant of your abdomen. There they are. And on your right, your left lower quadrant. And her sounds were easy to elicit. Sometimes it may be difficult, and you should listen if they're having hypo sounds or no sounds at all. You should listen for a full 5 minutes. Next, you want to percuss. So we're going to listen for some liver borders, and we're going to start with the top, and your liver is on your right costal region, so we're going to palpate from tympani to dullness, and with the writing instrument or something you can make a little mark there, and then you percuss from the bottom upward during tympani until you get some dullness, and that would be your lower margin of the liver. And so measuring to see if it's enlarged, you want to take a centimeter ruler, and it's exactly 4 centimeters, and it would be normal to be between 4 and 7 centimeters, so that's perfect. You want to try and palpate their spleen, and also watching their face for any tenderness. Is any of this tender? No. The spleen is normally not palpable. You can hook your fingers under the left costal region. I don't feel it, and she doesn't appear to have tenderness. You can also palpate their liver for any enlargements, and we determined that that was normal size. You can do light palpation to get them used to your feel, and then you want to come along and do deeper palpation and watch their face for any flinching or tenderness, and feeling for the organs, feeling for any masses, and that all appears to be normal. While you're in this abdominal region, you don't want to forget to auscultate. I should have done this earlier, with the bell to the aortic artery, and that's right above the umbilicus. I don't hear any bruits, you should not. And then the renal arteries, the same, you don't want to hear any bruits. And then the iliac arteries. Okay, and all of that appears normal. I'm gonna, while you're laying there, I'm gonna also, you want to auscultate the femoral artery. You should not hear any bruits. And you want to palpate the femoral arteries, and they should be bilaterally, symmetrically, and they are. I want you to try to lift your legs, okay, and they're at the same time, and they're even. I'm going to adduct your leg there. Do a little range of motion. Is any of that hard for you?
No.
And I don't hear any clicks or pops. You want to observe skin coloration. You want to look for any vascularities, any sores, lesions, bruising, hypopigmentation or hyperpigmentation. You want to feel the popliteal pulses, and those should be bilateral. You want to feel temperature, and it should be even. You want to do the dorsalis pedis pulse, and those should be palpable behind the big toe there on top. And you want to do the posterior tibial pulses, and those are even. While you're here, you want to do a capillary refill of their toes, and it should be less than 3 seconds, and it is. Her feet are very cool, but they're not excessively sweaty. The coloration is good on her feet. There's no swelling or edema or erythema. I'm going to ask you, I'm going to help you to sit up, okay? I'm going to have you hang your legs off the front there, and we're going to test the patellar reflex. Oh, great. Got it good. Okay. I'm going to extend your leg here and dorsiflex your foot and do your Achilles. Good, I felt that. And there we go. I'm going to have you stand, and I'm going to have you walk that way, and I'm going to observe your gait. You can also do this when they walk into the room, and she doesn't appear to be deviating to one side or the other. There's no limp, no crepitus. Can you squat for me? I'm listening for crepitus here. And she has even muscle strength, and she does that fairly well. I'm going to have you bend over and touch your toes. Feeling the spinous processes. Looks normal. Also looking for alignment of the hips. They appear to be normal and bilateral, symmetrical. Okay, and I believe this finishes our head to toe physical exam. Thank you for watching.